Come back to class. This is part 2 of Graves' disease. Now, today we're going to talk about what are the functional medicine options for patients who have Graves' disease or any other autoimmune disease, may it be lupus, rheumatoid arthritis, Sjogren's disease, scleroderma, mixed connective tissue disease, psoriasis, type 1 diabetes. What can you do in addition to or as an alternative to your standard medical care? The basis of this video is research done by Dr. Alessio Fasano and published almost 24 years ago. Dr. Fasano, as you might not know, is founder and director of the Center for Celiac Research at Mass General Hospital and a Harvard professor. Now, he proposed in 2000 what we now know as the autoimmune triad. He said for you to have any autoimmune disease, you need 3 things. 1, you need to have a genetic susceptibility. Simply meaning that somebody in your family has had an autoimmune disease and you inherited genes that would increase your risk. Second, he said you need a trigger. And we understand now that these triggers may vary from foods, infections, toxins, stress. He also said you will need to have leaky gut syndrome, which we now term increased intestinal permeability. Now, the genetics we can't change, but the triggers we can remove. And we can change your diet, we can get rid of germs and toxins from your body, whatever they may be. Once we find them, we can eliminate them. And that's one of the first steps in beginning the process of healing from autoimmune diseases. So each patient is different and may have 10 different patients and they have 10 different triggers. So one size doesn't fit all. An assessment would have to be done. Second, and very importantly, all autoimmune patients would necessarily have leaky gut syndrome or increased intestinal permeability. Now, this may be a very difficult concept, but your bowel, your gut, has the ability or has the role to digest and absorb food and to take in the nutrients from your diet and allow to pass through the things that you don't need, the bacteria, the waste products. Your bloodstream is separated from the intestinal lumen by a lining that's 1 cell layer thick, very, very thin. And if that lining is damaged, which in many people it is, if you have gas, bloating, constipation, diarrhea, abdominal cramps, these are signs that you may have a damaged intestinal barrier. This causes things to now go through into your bloodstream that shouldn't get through and trigger off an autoimmune response. And so you get an autoimmune disease and food allergies and various problems. This can be fixed. And this can be fixed by what we call the 4R program. First R, remove. So remove from your diet things that may be causing your symptoms and your leaky gut. So you remove harmful bacteria. You remove foods that are known triggers. You remove various chemicals and additives. And second would be replace. So we put back into your body digestive enzymes, acids, supplements, whatever your body may need to function properly in terms of your gut function. The third R is re-inoculate, where we put back into your gut good bacteria that may have been absent for various reasons. Maybe you were not breastfed, maybe you were born by C-section, maybe you had lots of antibiotics, and maybe you had lots of processed foods. So using probiotics and prebiotic and probiotic foods, like fermented foods and yogurt, we can rebuild that microbiome, the bacteria in your gut. And the final R is repair, where we give you supplements like L-glutamine and omega-3 and various vitamins to rebuild and restore the integrity of your intestinal lining. Now, I know these seem all complicated. You should seek out the help of a functional medicine doctor or even a naturopathic doctor who is knowledgeable about the tests that you need to do to confirm that you have these problems and what supplements to give you and the dosage and the order in which you take them and the diet for you to go on. But there is an alternative treatment for autoimmune disease. and many persons have benefited. I personally have supervised persons' treatment who once had rheumatoid arthritis, for example, and got no medication and now have no rheumatoid arthritis. I have had persons who have had autoimmune thyroiditis who got no medication and now are without any thyroid problems. So autoimmune disease, while they may vary and while their responsiveness to treatment may differ from patient to patient, there is an option to begin to restore balance and normality to your immune system and help you on the path to recovery. Even if you are on medication or you do traditional methods of treatment, these certainly benefit you and will restore many of the lost function and help your body to heal.